Hello, everyone, and welcome to our Empower Hour volunteering with Target Ovarian Cancer session. We're so pleased that you could join us today. I'm Maya Potter, the Events and Digital Community Officer at Target Ovarian Cancer. In today's session, Sue, Claire, Suzanne, and Amy will be speaking about their own experiences and how they each started volunteering with Target Ovarian Cancer. Hannah, Kirsten, Gina, and Pamela are also joining us from the Target Ovarian Cancer team to give additional information about how you can get involved in a way that feels right for you and answer any questions. We will now start the session with our first speakers, Sue and Hannah.
Hello, my name is Sue. I was diagnosed with ovarian cancer in February of 2017. After treatment, I decided I wanted to raise awareness and raise funds for Target Ovarian Cancer. And as such, I now shake and rattle my bucket at mainline, London mainline and underground stations. It's something that I find extremely rewarding, not only to raise awareness for vital research, for patient support, but it's a good way of connecting with the general public, explaining the signs and symptoms of ovarian cancer, because early diagnosis, I think, is key. There's too many ladies that are diagnosed at late stages, and that does have to stop. So ladies, or anybody, if you're thinking about, shall I volunteer to rattle my bucket, then go for it. Definitely go for it, because it is very, very rewarding.
Hello everyone, I'm Hannah. I'm a support engagement officer. I'm part of the fundraising team at Target Ovarian Cancer. And yes, I'm promoting kind of all of the volunteering work that the fundraising team does, because they are so in need of any volunteers to help with both bucket collections, as Sue mentioned, and also cheer points, but we'll get into that a bit later. So bucket collections are a brilliant way to raise both donations and awareness of Target Ovarian Cancer, as Sue mentioned, because they just bring us into people's awareness, and we can easily be seen with our big old sign. And there's Tiago with lovely volunteers collecting for us. They're really great to do. I took part in one at Paddington Station during Christmas, and it's a really nice thing to do, especially because you get to meet lots of people who support the charity, as well as the wonderful people who work here as well. And it's a lot of fun and a really nice way of bringing in some money. And at the times it can feel like you're not raising a lot, but at the end of the day you often raise quite a bit. So the one thing to do is to ask Tiago to be included on the bucket collectors list. So you'll be the first to know about any upcoming collections as they happen throughout the year. And really you only need to be volunteering for kind of minimum of 2 hours ideally, but you can volunteer for as long or as little as you like. Next slide, please. So other one as mentioned is cheer points, which is an essential part for runs and sporting events. They are, again, a really fantastic way of cheering on people who are running for Target Ovarian Cancer. They're brilliant to get involved with. Admittedly, I've not taken part in one for Target, but I really, really want to. But I have done the London Marathon. And if you've not done a cheer point, I highly recommend doing the London Marathon, because it's just a fantastic atmosphere. Everyone's so excited and happy. Lots of charities will also cheer for your charity and your runners as well. So that's really, really nice. So it's just got such a lovely vibe to it. And yeah, they're just, again, it's a really lovely way to meet people who are both supporters and also the team at Target Ovarian Cancer. Next slide, please. So yeah, and here's a quote we've got from Lynn, who was a volunteer for Overdressed in London, and of course that means she was kind of taking part in the cheer point. So yeah, it's a really nice way of getting involved and spending a few hours cheering people on, and it really does fly by. So I do highly recommend it. We have some runs coming up in April, both London Marathon and London Half Marathon as well. Next slide, please. These are my quotes, just to kind of give you a bit of an idea of what I enjoy doing and why I really love doing it. So I definitely think it's worthwhile if you've never volunteered either at a bucket collection or at a cheer point. Okay, and these are kind of the essential details for either the bucket collections or cheer points. If you're interested in being part of a cheer point, you can also get in touch with the fundraising team by email at fundraising@targetovariancancer.org.uk, but we'll make sure that you can always contact us if you're interested in being involved in any of the volunteering events and to find more information out about them. But we highly recommend you sign up. And as mentioned, London Landmarks Half Marathon is taking place on the 6th of April, and London Marathon is taking place on the 27th of April. So if you're interested in signing up for either one, I definitely recommend getting in touch with us soon, because they're really, really great. But yeah, we definitely need more volunteers involved. Okay, and I shall pass over to Claire and Kirsten.
Hello everybody, my name's Claire McKay. I'm 42 years old. I live in Hampshire and I work in education. Just a little bit of sort of context as how I came to work with Target. When I was 32, I was diagnosed with a stage 1A ovarian cancer. I was incredibly fortunate that my GP was very on the ball, so it was caught at stage 1A, but it did mean that I had a full hysterectomy at the age of 32. And I've been in surgical menopause ever since. I came upon Target because I needed some support really. Being a younger woman with ovarian cancer, there wasn't an awful lot of support out there until I came across Target. I've been really fortunate that Target have given me some wonderful opportunities to be involved in their work, from things like visiting Parliament to some of their events. I'm currently working on a GP education programme with some of the Target team, and I've also been recently involved in their overview panel. So I just wanted to take a minute to talk through some of those things in a bit more detail and hopefully to inspire some of you to get involved with the Target Ovarian team, because they are all fantastic. So when I was first diagnosed, I struggled to find information that related to me. A lot of the information was for later stage ovarian cancer, because as hopefully we're all aware, that is often the case, that these cases are diagnosed much later. So early stage diagnosis was and still is quite a rare thing. So when I came across the Target website, it was such a relief to see other people's stories. And one of the things that Target does is regularly review the information that is on their website. And in the last year or so, I've become part of what's called their overview panel. And it's just a group of people that have either had ovarian cancer or kind of have an interest in it, who review the information that goes onto the website, into the printed leaflets, any information that is essentially available for the wider public. We see early copies of it, we're asked our opinions on it, simple things like the layout. Is the information there understandable? Is it something that we think somebody is actually going to be able to understand, to use and to benefit from? Our views are then taken into account, and that all goes into making the information on the Target website and in their leaflets much more accessible. It's really low effort on my part. It's literally just whenever they want you to read something, reading it. So if you're someone that doesn't necessarily have an awful lot of time, it's a brilliant way to contribute to Target without it taking up too much of your time. If you do have more time and you're more interested in other things, there are so many fundraising, thousands of fundraising things that you can get involved in through the year. There are also events that happen with Parliament, with your MP, that you can get involved in as well. And then if you feel comfortable talking about your story, again, that is something that could be useful for Target. So at the moment, myself and a member of the Target team are involved in a training scheme for GPs that are newly qualified or recently qualified. And I go along essentially as a case study. And the feedback from anything that I've done from Target is it's those personal stories and people being able to share their experiences that make the biggest impact. At the end of the day, we are people that have lived with ovarian cancer. So actually, we're the experts in our experience. So if you feel able to, I would strongly encourage you to get involved in any way you can. It's no massive commitment. You do as much or as little as you want, but everything makes a difference. And the overview panel for me has been one of those things where actually, had the information been as good as it is now when I was diagnosed, I would have had an even better experience, and I was incredibly lucky. So actually being involved in something that improves things for people coming down the line with ovarian cancer makes it seem worthwhile. My tagline through all of this is turning a negative into a positive, and the work that I've been able to do through Target has allowed me to do that. So if you can get involved in any way, I would strongly encourage it. It really does kind of give you a feeling of actually being able to make a bit of a difference. Thank you.
For everyone else, I'm Kirsten, Interim Information and Support Manager at Target Ovarian Cancer. So following on from Claire's wonderful introduction, I'm going to tell you a bit more about the panel and how you can get involved. So it is a group of volunteers living with or affected by ovarian cancer. We ask our panel members to give their feedback to shape our health information and support services, and a wide variety of feedback helps us to take into consideration a range of voices and experiences. So this means that our information and support is helpful to everyone affected by ovarian cancer. As a panel member, you are helping to make our services and information the best that they can be. Next slide, please. As a member of the overview panel, you choose what you take part in. You can choose from a range of projects. So you can review our written health information. That's either our printed and downloadable guides and materials or our website information. We're also always looking to make more formats for our health information, so you can help us to create new multimedia. This could be videos, podcasts, or interactive online tools. You can give your views as part of our focus group discussions, fill in short surveys to help us improve our services, and by giving your quotes and tips for our written information based on your own experiences of ovarian cancer. We also hold photo and video shoots to support our written information, so you can choose to take part in those if you wish to. And on the right is a photo from our latest photo shoot where we had 5 wonderful women, including Claire, taking part, and we all had a brilliant day together. Next slide, please. So here are some examples of those projects in their finished formats. Our interactive online tools help those with ovarian cancer find out specifically what PARP inhibitors they're eligible for, or to find out more about the stage and grade of their ovarian cancer. We also have several animations and live action videos on our website, alongside written information, which you can see. And we have recently updated one of our guides about recurrence of ovarian cancer back here again, which you can see on the top right. So all of our health information projects shown here and more are available to be watched, read, or ordered on our website. So please do go and take a look if you're interested. Next slide, please. So what's involved? You can choose what projects you take part in, and they can be done from the comfort of your own home with feedback over email, phone, or video call. As Claire said, it's very the time is not great that you need to be involved. We also expect to invite you to join just 3 or 4 projects a year, but you can decide how many projects you take part in. It's absolutely up to you whether you'd like to do more or less than this. We also suggest that our members stay on the panel for a year so we can gather lots of feedback from you, but you can continue for longer if you wish to. And also, there's no problem if you can't do a full year. There's also the opportunity to meet others affected by or living with ovarian cancer in person at photo and video shoots if you want to. Next slide, please. So who can take part? Essentially anyone can join the overview panel. The only guidelines that we have is that you're 18 years old or over, and if you're having treatment, that your treatment is in the UK so that you can share your relevant experiences. Taking part in the panel is open to everyone affected by ovarian cancer. So it's those with the diagnosis, family and friends, but also to anyone with an interest in ovarian cancer too. Our information is for everyone affected by ovarian cancer. We want to hear from people from a range of backgrounds. So we're particularly looking for new members from Black, African, Caribbean and Asian backgrounds, the LGBTQIA+ communities and anyone with a disability. You don't need a high level of medical understanding to take part in the overview panel. In fact, we particularly want to hear from those without it. Next slide, please. We've got some really interesting projects coming up this year, and we'd love for some new members to join the panel to support us with them. So we're looking for people to take part in an online focus group to help us develop our multimedia about genetic testing on the 8th of April, 2 to 3 p.m. We're also reviewing our genetic testing guide this year, and we'll be inviting our members to give their feedback on the guide and to join a photo shoot if they wish to as well. If you've had genetic testing and you have a gene variant, this could be an opportunity that you might like to take part in. We'll also be reviewing our ovarian cancer symptoms, diagnosis, CA125 blood test and ultrasound scan information. These are our flagship materials at Target Ovarian Cancer, and they help to educate everyone about the symptoms of ovarian cancer. There will also be other opportunities to take part throughout the year, but these are just some of our bigger upcoming projects. If anything sounds interesting to you, please do either apply for the panel or ask us to find out more. So on that note, next slide, please. I'll give you some more details about how you can join the panel. I hope I've given you a really good flavour of what the overview panel is and how you can get involved. So joining the panel is a really great way to give your feedback to make sure our information and services are helpful, relevant and supportive for everyone affected by ovarian cancer. To join the panel, we ask you to fill out a very short online application form. Go to targetovariancancer.org.uk/overview panel, and that's over with an A as well, just to make note of that. But if you have any questions at any time, please just email me or my colleagues Sophia and Gina at info@targetovariancancer.org.uk. Thanks for listening, and I hope you can join us on the overview panel soon. Thank you. And now I'll pass over to Gina.
Hi, thank you so much, Kirsten. So my name's Gina. I'm the Supportive Services Operations Manager here at Target Ovarian Cancer. And I'm here to tell you a little bit about a Digital Champions volunteering opportunity that we have as part of our online community. Next slide, please. Thank you. So what are Digital Champions? So we launched this project back in August of 2024. And the idea was to bring on a team of volunteers to help us with moderating and spreading the word about our online community. So some of you may be members of our community already, but for anyone that doesn't know, we have 2 Facebook groups which are designed to support and offer advice and connection for anyone affected by ovarian cancer in the UK. So no matter where you are, you can log onto the groups and kind of speak with people that understand what you're going through and offer support and advice to each other. So the groups have been running for quite some time, but we thought it would be a great way to get some of our members involved in kind of the moderation side of the groups. So we're about to hear from 2 of our volunteers, Amy and Suzanne, who will share a little bit more about their roles with you. And then I'll give you some details of how you can apply if it sounds like something you're interested in. So next slide, please.
Hi, my name's Suzanne, and I've been a member of this community since May 2021 and a digital champion for about a year now. Well, I wanted to do something having retired over a year ago, but I needed something flexible, so something I could do from home, but also something that fitted in with traveling and all the other day-to-day stuff I've got to do, really. I knew when I read the ad that I had the job experience, but I think more importantly, I also had that first-hand experience about how ovarian cancer impacts and sort of changes your life. And then also, I think more selfishly, if you like, it was a great way to tap into the extensive knowledge and experience of a really supportive community. So I was getting the information that I needed as well. For me, I think just witnessing the resilience and the courage of the people in this community. It's really inspiring. There's a lot of hope, there's a lot of positivity, and I think that at times that helps me get through some of my own darker moments and some of the fears that I'm sometimes experiencing about living with ovarian cancer. I think, rather unsurprisingly, it's always challenging when you read a post about a member of the community that might have passed away, or a member of the community that's coming to treatment for end of life. I think it would be really hard not to be impacted by those things. Equally, very supported through that process. But what's also been surprising is, on the other hand, there is a lot of positivity and good news stories about treatments and about some longevity of people living with this disease, which I think if I had that information years ago, I think perhaps it would have been a better outlook that I would have been able to take in earlier on in my own journey with ovarian cancer. I would say it's totally flexible. You are 100% supported 100% of the time. And my experience is that you will get back much more than you put in. So it's worthwhile, totally worthwhile doing it.
I'm Amy. I joined the online community about 2 years ago, and I was originally diagnosed in 2018. So I was looking for a space to connect with other women that have had a diagnosis and also find support and share how to manage side effects of surgery, treatment, and living with a diagnosis. I was first interested in the digital champions role because I was looking for a way to give back. I feel like I've taken from charities that have been really supportive, and I felt with Target, they provided so much support and information to me, and it felt like something I could do to give back. And also being in that space of a diagnosis and not knowing how to handle it and where to turn, I wanted to be able to helpfully signpost women and their families and people affected by ovarian cancer into the right support services. I most enjoy the supportive community that at any time when someone reaches out and needs support, there's always someone there to provide support to them, be that by advice or just say, I'm here for you or thinking of you. It really helps, and that's any time of day or night. I also enjoy the fact that there's a support line that you can direct people to, that can phone up and speak to someone if they need to. And just this huge sense of community that the online groups provide. I think it's imperative when you're going through such a challenging time. I think what I found surprising was the huge sense of community that the online group provide, that there's advice and support from such a huge range of people. And I think I found that quite heartwarming, that in people that could be going through the most difficult time, they got a huge range of support from that group. Say, if you're feeling nervous about joining as a digital champion, just know that there are people to support you. You'll get support from Target Ovarian Cancer. You're not on your own. If you're worried about the technology, people can help you. They also provide training. There's a support line, so you're not on your own with it.
So hopefully that gives you a bit of a sense of what the role involves. So I just want to say a huge thank you to Amy and Suzanne for sharing a bit about their experience of being a digital champion. So just to let you know kind of a bit more of the day-to-day role itself. So a big part of the role as a digital champion is the moderation side. So in terms of membership requests and keeping an eye on posts and discussions that take place in the communities. But there's also a lot of opportunities to get involved in the engagement side as well. So in terms of kind of helping members get answers to their questions, signposting them to different resources and support that we have available, and just kind of being there just to be on hand and offer support and advice yourself as you would as a member usually as well. We're also really interested in having some support with spreading the word about the communities. So whether that's doing things on social media, maybe going out to a local community or healthcare professionals and just letting them know about us and the fact that this online community is here if people need it. But there's no pressure to take part in that side of it if that's not what interests you. If you would prefer just to stick with the moderation side as well, that's completely fine. So we are currently recruiting for some more digital champion volunteers to join the team. So hopefully this role sounds like something you might be interested in, and you can find all of the information on our website if you would like to apply. If you have any kind of concerns about the training or experience that you might need, just to reassure you, there is really no experience needed for this role. It's very much open to anyone that's interested. So we really would encourage you to apply if this sounds like something you might want to do. We can also give you all of the training and support that you needed to get started in the role and throughout the role as well. So we give moderation and engagement training to all new volunteers that join the team. You'll be invited along to monthly team meetings. You can kind of connect with the rest of the team as well and meet the other moderators that we have. If you have questions or want a second opinion on something you've seen in the groups, you can ask the team as well, but we've also got staff on hand to kind of help you as much as you need it. And then we've also got a private Facebook group for moderators, the Employee Assistance Programme and Volunteer Manager. So there's plenty of support there whenever you need it. As I said, there's no prior experience needed, as we'll give you all of the training that you need. And one of the great things about this role is that it's designed to be flexible. So you can really choose the days and times that you want to help out based on when you have time available. So if you want to do something in the evenings, on the weekends, in the mornings, whatever kind of fits around your schedule, we have a rota, so you can just go on and add your name to whenever you might be available, even if it's different days and times each week, that's completely fine. So hopefully that sounds interesting to you. And if you would like to apply, then please visit our website to complete an application form. But just to reassure you again that this role will stay open. So if now doesn't feel like quite the right time, you can just join the communities if you want to. You can come back to the website at any point and put an application in further down the line if that feels like a better time for you. And you can also get in touch with us via the email at the bottom of the screen there, where we can set up a quick call with you if you're not quite sure about the role, or if you just want to find out more before you apply. You can have a call with one of the members of the team and we'll kind of talk you through exactly what the role involves and answer any questions that you might have, if that's useful at all. I think that's all from me, so I'm going to hand over to Pamela now. Thank you.
Hi, thanks, Gina. So as Gina said, I'm Pamela. I'm the project lead for Target Ovarian Cancer's peer support project. I'll be giving just a brief overview of the project, which after consultation with our community has been given the overarching title of Let's Connect Target Ovarian Cancer Communities. And alongside this, I'll mention the volunteering opportunities that are available. Could the first slide, please? So the fundraising team have secured generous funding from the National Lottery's Community Fund for this project. This is because they were able to demonstrate that it's led by the express needs of this community. It was a result of over 500 survey responses from yourselves and a number of focus groups as well, all identifying a need for this. It's a 3-year project, but these are permanent services. We're building sustainability in now. And the next slide, please. So these are 3 strands to the peer support project, all again named after consultation with the charity's ovarian cancer community. Digital champions has already been spoken about by Gina, so I'll be concentrating on the second 2 strands here, and I'll begin with the local face-to-face groups. If I could have the next slide, please. So this is going to be the first nationwide service available for women with a diagnosis of ovarian cancer to receive tailored peer support to navigate their experience. These groups are going to be face-to-face social groups that can be exclusively for women with a diagnosis of ovarian cancer, and all facilitated either by a peer drawn from the group or by a healthcare professional. It's going to be a safe space to talk openly with peers. We'll be providing tailored training and ongoing support for all these volunteers, or support group facilitators as they're being referred to. And I'll outline this training after we look at the practicalities of the support groups. Next slide, please. So in terms of practicalities, on the budget, what's listed here is what's covered, obviously enough for each group. The reasonable expenses refers to, for example, arts and crafts materials that support group facilitators might want to use during their group get-together. Reasonable volunteer expenses are refundable, and they should really just be travel expenses and the cost of milk and biscuits, really. Venue hire can be paid by us via invoice, and as far as possible, that'll go for materials too. We don't want volunteers putting their hands in their pockets, even in the short term, for anything other than bus fare and biscuits. We've tried to make signing up as volunteers admin light as possible, and there isn't a DBS check, so the role isn't eligible for this. As far as possible, the training will be virtual, but if someone doesn't have access to a laptop or similar, we'll certainly find an alternative way of delivering that. Digital champions and support group facilitators become part of an employee assistance program, as Gina mentioned, and that provides access to support 24 hours a day, 7 days a week for our volunteers. Training for support groups facilitators, we obviously can't anticipate every situation that the facilitators may encounter, but we can provide some basic tools. So the training will include, for example, situational guidance. For example, what you might say if somebody's talking over somebody or interrupting somebody. Conversational tools such as asking open-ended questions. Emotional support. So, for example, if someone's too upset to speak during the group, how you might help and support them. We want to make sure that our volunteers feel confident and well equipped for the role, and that they feel supported by both the charity and their fellow volunteers. We'll be ensuring that facilitators are aware of all the services that Target Ovarian Cancer provides so that they can signpost anyone with any health-related concern. And we'll also be covering external organisations as well. So, for example, if somebody tells a volunteer that they've been experiencing domestic abuse, they'll know where to signpost that person for support. Because we don't want volunteers to be carrying around anything with them that they don't know what to do with. Group facilitators could speak with me about anything that's come up in their group, and we'll also be arranging bi-monthly virtual get-togethers for facilitators to share skills and experiences. And as has been mentioned, there's also the free access to external support. We'll always work to protect the health and well-being of our volunteers. Next slide, please. So where are we focusing on initially? So Yorkshire and the Humber, this was promised to the lottery as the first focus area, and it really doesn't matter development-wise which region we start with. And anyway, this year we will need to focus on at very least 2 regions. So I'm starting with Leeds and Harrogate. We've already had interest from the health sector in both these cities, and one other city as well, possibly Wakefield. We'll see how we go. Health sector professionals in all 3 of these areas have already expressed their willingness to support the development of our local support groups, and have told me of the real need for them in these cities. For the East Midlands, the charity's primary care team have especially good contacts there, and a member of this community has introduced me to clinical nurse specialists at both Derby and Burton hospitals. For the North Midlands, yesterday I delivered a presentation to the Macmillan Information Centre staff at North Birmingham hospitals. They are very kindly introducing me to their related contacts in Stoke and Stafford. I know that Greater Manchester looks a bit random here, but I've included it as we have some potentially useful contacts here from among the staff team. You'll see that I'm not going region-wide with information initially, but rather picking out a small number of cities to focus on. I'm staggering these approaches because if Take Up is as enthusiastic as I think it will be, we need to be able to keep our promises and not overextend ourselves. Of course, we'll be rolling these groups out across England over the next 3 years, but we'll be doing it at a steady, measured pace to make sure that each one is sustainable over the long term. So what am I asking from these organisations? Ideally, I want them to start promoting the service immediately, because as soon as we have 6 women engaged in one area, we can begin the process of setting up a local group. That in itself takes about 6 to 8 weeks, because we'll need to identify a venue, we'll need to sort of recruit and train the volunteers, we'll need to engage groups and organisations at a neighbourhood level in the third sector and health sector, etc. I've been given room to hope, so we'll see how we go. And the next slide, please. So pop-up connections, this is the final strand of the peer mentoring project. These are the ad hoc activities that you may have seen referred to. So organisers and participants could be anyone with lived experience of ovarian cancer within our community. Organisers or planners will be telling us about an activity that they're proposing to arrange, such as, for example, a walk in a local park or an activity based around their own interests, like an art class. We'll promote it as long as it's both safe and sensible, not least because these activities will need to be both to be covered by the charity's insurers. And we provide people within our community the opportunity to sign up. We're still finalising the backroom admin to support these activities. We're planning on launching it in the spring. This is casual off the cuff, the other side of the coin to the formalised support groups, and again, something identified by the ovarian cancer community as being needed. So you might want to plan an activity or join in one when you see one local to you promoted by us. You might want to learn more about facilitating a local group or prefer to join one as a member. It's whatever works for you. If you'd like to find out more about anything related to the Peer Support Project, please do contact me. My contact details are on the next slide. And that's it really. I'm going to hand back to Maya, and probably Maya will be fielding questions, I'd imagine.
Thank you, Pamela. And thank you to all our wonderful speakers for sharing your experiences, and to the Target team for providing more information on our volunteering opportunities. We now have some time to ask the Target Ovarian Cancer team some questions. So I think the first question that comes through is for Pamela. So it's asking if there's any plans for groups in Scotland, and yeah, is the project kind of only being set up in England, or is it going to be wider?
Well, the funding is only to cover England at the moment from the National Lottery funding. So it's going to be an England-wide service, but this does allow us to develop and evaluate the service. And our hope is that we're going to make it available across the nations in the future. And of course, wherever you live in the UK, you can access all our other support services now.
Lovely, thank you. So just some kind of other questions to provide a bit more information on some of the areas we've covered today. So I'll start with Hannah, kind of just about bucket collection. Do you need to bring anything with you to take part in a bucket collection?
Yes, you'll need to bring a photo ID, but you'll be told lots of information kind of about what to bring with you on the day, and otherwise we provide everything else, like collection buckets, a card machine, and you'll also be given a Target Ovarian Cancer t-shirt, so you look all official. And of course we generally recommend wear comfortable shoes and dress for the weather depending on the day. You know how the British weather is, so yeah.
Great, thank you. And another question for you. Do you have any other kind of volunteer opportunities at other events?
Yes, we do. So kind of in line with Cheerpoints, we also have our registration village. So that's kind of helping to sell merchandise, helping register people who are there for the race or the event, giving out t-shirts. And we've also got route marshals, so showing people kind of where to go and not get the wrong way. And so for that, you'll also get kind of a high vis vest and snacks. And then also we've got giving out medals at the end of an event or race.
Great, thank you. And sorry, final question for you. Do you kind of find out how much you raise when you take part in a bucket collection?
Yes, which is the best part of getting kind of to the end of that and finding out kind of afterwards from Tiago how much you've raised. So yeah, you will find out, and you'll get told maybe a week or so after the event.
Great, thank you. And then a question for Gina. So how much time do you need to kind of dedicate to volunteering as a digital champion?
Yeah, thanks, Maya. So at the moment, we typically ask volunteers to cover kind of 2 shifts per week. So that could be kind of whenever you want to. So it could be, you know, morning, afternoon, evening, any day of the week. But during a shift, you won't kind of be expected to sit at your desk or your phone kind of monitoring the groups at all times. It's really just kind of being on hand to check in, you know, for 5 or so minutes throughout that shift, just to see if there's anything that's popped up during that time. So yeah, kind of a couple times a week if you can, but it is very much flexible.
Great, thank you. And also, do you need kind of previous moderation experience or medical knowledge of ovarian cancer to become a digital champion?
No, nothing at all. So the online community isn't designed to give out medical advice. You'll never kind of be expected to do anything like that as part of this role. It's very much just kind of being on hand to help with the moderation and the admin side, but also helping to signpost members to other relevant information that we have. But we can give you a list of kind of all the different resources and things that might be useful to help you with signposting. And if you're ever unsure about anything or kind of how to respond to something that you see in the groups, just let a member of the staff team know, and we can always kind of give you a second opinion and some advice if that's useful.
Great, thank you. And then a question for Kirsten. Can those with a diagnosis still take part in the panel if it's been a few years since they've had active treatment?
Yes, absolutely. That's something that people with lived experience of ovarian cancer, whether they've had ovarian cancer treatment themselves or whether they're a family or friend of someone with a diagnosis at any time, can take part in the panel.
Just a reminder, I think we've finished slightly ahead of time, but just a reminder that if you have any questions, concerns, or would like to have a chat, our support line is open from 9 till 5, Monday to Friday. Please call us on our free phone number 0808 802 6000 to speak to one of our specialist nurses. But just to say a massive thank you to Sue, Claire, Suzanne and Amy for sharing their experiences, and the Target Ovarian Cancer team, and to all of you for joining us today. We hope you found the session helpful, and we hope to see you at another event again soon. Thank you.